Hi everyone, today we are looking at temporal and infratemporal regions, starting off with three very important fossa that we'll be covering in this video. Temporal and infratemporal regions include muscles of mastication that develop from mesoderm of the first branchial arch. The muscles of mastication are innervated by mandibular branch of trigeminal nerve. If you remember the table we studied, they are innervated by mandibular branch of the trigeminal nerve. So trigeminal nerve innervates the muscles of mastication, right? Only one point, only one joint, the temporomandibular joint, is present on each side between the base of the skull and the mandible to allow movement during speech and mastication. So you have only one joint in here and a very important joint. The parasympathetic ganglion is the otic ganglion, the only ganglion with four roots: sensory, sympathetic, motor, and secretomotor or parasympathetic. It has four roots: sensory and motor, sympathetic, and parasympathetic. And parasympathetic is the secretomotor, right? The blood supply of this region is through the maxillary artery. Middle meningeal artery is its most important branch, as its injury results in extradural hemorrhage. So over here we have maxillary artery, and its branch is middle meningeal artery, and it is very important because its injury will result in extradural hemorrhage. Good. Now moving forward, temporal fossa is, in order to understand these regions, the osteology of the temporal fossa and infratemporal fossa should be studied. The temporal fossa lies on the side of the skull and is bounded by a superior temporal line and the zygomatic arch. Now let's look at the temporal fossa. Here you can see this entire region here. This is temporal fossa, right? So when you talk about the boundaries, so interiorly it has zygomatic and frontal bones. So you can see this is the frontal bone, this is the zygomatic bone, which is the cheekbone, right? So if you notice, this is your entire temporal fossa, right? This is your temporal fossa. So interiorly you have zygomatic and frontal bones. So zygomatic and frontal bone, so that is the interior borders. I hope you won't forget that. Just have a photographic memory and just paste this in your memory. Posteriorly you have the inferior temporal line and the supramastoid crest. So posteriorly we'll have inferior temporal line and supramastoid crest. So this is the mastoid process, and then here somewhere you'll have the supramastoid crest, right? Then superiorly you'll have the superior temporal line, and inferiorly you'll have the zygomatic arch. This is the zygomatic arch, right? So let's recap. Interiorly you have frontal and zygomatic bones. Superiorly you have the superior temporal lines. Posteriorly you have what do you have posteriorly? You have the infratemporal line and also the supramastoid crest. And inferiorly you have the zygomatic arch. So that's it. The floor consists of the parts of parietal, frontal, temporal, and greater wing of the sphenoid bone. So all of these bones are here: frontal, parietal, temporal, and sphenoid. Temporalis muscle is attached to the floor and inferior temporal line. So very important muscle here, entire region, is temporalis muscle. It's a fan-shaped muscle, this one right here. This is temporalis muscle, and if you open the table from Snell's, which is having the muscles of mastication, can you recall? You have medial pterygoid, lateral pterygoid, temporalis, and masseter. So this is temporalis. It's a fan-shaped muscle. It originates from the floor of the temporal fossa. So it originates from the floor of temporal fossa, and it inserts at the coronoid process of the mandible. So this is the mandible, and you can see it is inserting at the coronoid process. So it originates from the floor of temporal fossa, and it inserts at the coronoid process, and it is supplied by the mandibular division of the trigeminal nerve. That's what we studied here. That mandibular branch of the trigeminal nerve is what gives the muscles of mastification their innervation, right? Now moving forward, what are the contents of this temporal fossa? We already know one, which is temporalis muscle. Other than that, you'll have the middle temporal vessel. In this diagram also you can see middle temporal artery is here. Then you'll have the zygomatico-temporal nerve and artery, zygomatico-temporal nerve and artery. You'll have deep temporal nerves for supplying temporalis muscle. You have deep temporal artery, branch of maxillary artery. So you have deep temporal nerves and vessels. You'll have zygomatico-temporal nerve, and you have middle temporal artery. So everything related to the temporal thing, right? Temporalis muscle, middle temporal artery, and zygomaticotemporal nerve and artery. Deep temporal nerve, deep temporal artery. I hope it makes sense. Everything is temporal. If you read it once, you'll understand the contents. So this is your temporal fossa, right? Now, temporal fossa also connects with a few other structures. Let me just see that as well. So first of all, you have to refer to this from the book Snells, and you can open page number 664. There you'll notice the entire chapter. So temporal fossa, its primary communications are orbit where the inferior orbital fissure. So it communicates with the orbit where the inferior orbital fissure. Where is the inferior orbital fissure? Right here. You can see this is inferior orbital fissure. So that's how it communicates. Over here you can see from the side you'll be able to see it in much better fashion. This is inferior orbital fissure and it opens in the orbit. So that's how your temporal fossa connects with the orbit. Inferior orbital fissure and infratemporal fossa. It also communicates with the infratemporal fossa. So infratemporal fossa is deep to the zygomatic arch. This is zygomatic arch, so within it you'll have the infratemporal fossa. Now moving on to infratemporal fossa, you have this is an irregular space below the infratemporal arch. So if this is sorry, below the zygomatic arch. So here inside we'll have infratemporal fossa. Anteriorly, it is bounded by the posterior surface of maxilla. So if you go in and you stand there, you'll notice there's maxilla inside. The roof is infratemporal surface of the greater wing of sphenoid. So there's greater wing of sphenoid also there. And if you may be wondering where's sphenoid, so this one right here is sphenoid. So you have greater wing of sphenoid as the roof. Medially, so medial to that here, what do you think? Which is this bone? This is the temporal bone, right? So medially, you will have the lateral pterygoid plate of the sphenoid bone and the pyramidal process of the palatine bone. So you have the palatine bone, and you can also mention temporal bone. So this is our medial relation. So medially, lateral pterygoid plate, if you even say that, that's more than enough. And laterally, you'll have the ramus of the mandible. So laterally, this is the ramus of the mandible. So you have to go within, right? So it's not going to be here actually. That's the reason it's not temporal bone. It's within. Like if you go inside, somewhere here. So ramus of the mandible is laterally. Medially will be lateral pterygoid plate of sphenoid. Roof would be of greater wing of sphenoid. And anteriorly, there will be posterior surface of the body of the maxilla. So these are the boundaries. And what are the contents? You'll have lateral pterygoid muscle, medial pterygoid muscle, because everything related to the mandible. So inside the mandible, in the medial aspect, you'll have medial pterygoid, you'll have lateral pterygoid. These are also the muscles of mastication. You'll have mandibular nerve with its branches, and let me just open the table of this. So there you can see that uh, lateral and medial pterygoid muscles, they're supplied by the mandibular division of the trigeminal nerve, right? So also this will have the so when you talk about the medial and lateral pterygoids, you can see the diagram. This is the diagram is so bad. Anyway, so this is the lateral pterygoid. This is the medial pterygoid. This one right here is the medial pterygoid. This is the lateral pterygoid. So medial pterygoid from the it it originates from the tuberosity of maxilla and lateral pterygoid plate. So tuberosity of maxilla and lateral pterygoid plate, and it will insert at the angle of the mandible. Whereas lateral pterygoid, it originates from the greater wing of the sphenoid and lateral pterygoid plate, and it will insert in the neck of the mandible and the articular disc. Remember, we already studied this. So you can see where they're placed. So that's the reason there's a content of the infratemporal fossa. So lateral medial pterygoid you've mentioned, the mandibular nerve with its branches, an otic ganglion, maxillary nerve with posterior superior alveolar nerve, chorda tympani, which is the branch of the seventh nerve, which is also known as the facial nerve. So chorda tympani is a branch of the facial nerve. That also you'll find here. First and second parts of maxillary artery with the branches. You'll find posterior superior alveolar artery, branch of third part of the maxillary artery, and you'll find the accompanying veins. No need to learn a lot of contents. Even if you learn two of them, it's enough. The junction of the back of the head with the neck is indicated by the external protuberance and superior nuclear lines. This is just an extra information. It has no relevance with the fossa. Now, if you talk about the primary communications of infratemporal fossa, So it communicates with the temporal fossa, and this is through the gap which is deep to zygomatic arch. So that's how it communicates with the temporal fossa. So here is temporal fossa. So this is going infratemporal fossa is going to infratemporal fossa. So below the temporal bone. So infratemporal is going to communicate with the temporal fossa through the gap deep to the zygomatic arch. Then it will communicate with the orbit by the way of the inferior orbital fissure. Through inferior orbital fissure, it will also communicate to the orbit. And I hope you understood where is inferior orbital fissure right here. It's going to communicate with the orbit right here. Then it communicates with the pterygopalatine fossa via the pterygomaxillary fissure. So where the pterygomaxillary fissure, this is going to communicate with the pterygopalatine fossa. That is going to communicate with the nasal cavity where the sphenopalatine fossa. So pterygopalatine fossa is another thing that we'll discuss. It is here. And then you have pterygomaxillary fissure that is going to help with the communication. Other than that, it communicates with the submandibular region, which is deep to the mandible. The submandibular region also right here. Then it communicates with the cranial cavity via the foramen ovale and spinosum, tympanic cavity via the petrotympanic fissure, and maxillary teeth and sinus through the posterior superior alveolar foramina. Now talking about the pterygopalatine fossa, it is right here. This is pterygopalatine fossa. It's just a small, roughly pyramidal shaped place located in the deep lateral aspect of the head, immediately posterior and inferior to the orbit. Its major contents are the terminal branches of the maxillary artery, maxillary nerve, nerve of the pterygoid canal, and pterygopalatine ganglion. It is bounded anteriorly by the posterior or infratemporal surface of the maxilla. So, posterior or infratemporal surface of the maxilla. Posteriorly by the base of the pterygoid process of the sphenoid bone. So, this is sphenoid bone. So, posteriorly by the base of the pterygoid process of the sphenoid bone. Superiorly, it is bounded by the apex of the. This is right here, right? So superiorly, it is bounded by the apex of the orbit. So orbit extends till here. So apex of the orbit. Then inferiorly by the inferior margin of the pterygomaxillary fissure. So inferior margin of the pterygomaxillary fissure. Medially, posterolateral wall of the nasal cavity. So posterior, medially, you'll notice obviously there'll be nasal cavity. So wall of the nasal cavity, and laterally pterygomaxillary fissure once again. Right. So this is pterygopalatine fossa. Now, primary communications, it communicates with the infratemporal fossa, where the pterygomaxillary fissure is going to communicate with the inferior temporal fossa. Then it will communicate with the cranial cavity through the foramen rotundum, to the external base of skull through the pterygoid canal, to the nasopharynx with the pharyngeal canal, to the orbit by the way of inferior orbital fissure, maxillary teeth and sinus through the infraorbital canal, oral cavity and nasal cavity through pterygopalatine canal and sphenopalatine foramen respectively.